I am sorry to tell you that the depth of this cancer denotes or shows that it is in depth, and this might means, because not confirmed, that it might be spread. What you are going to do for me now, don't say palliative. We are not sure about his spread or not. We need further test and assessment. You will assess him clinically for any lymph node. Okay, so we'll assess you and make some other tests and scans to confirm whether there is a spread or not. What? Okay, and then the management plan will be planned accordingly. Okay, but up till now we are not sure if there is mets or not. So yes, it is confirmed melanoma, but unconfirmed or uncertainty about the spread. Take care from this. This appear in your. And here, ask about the job, and please, we need from you to avoid sun exposure. To avoid, because this may be repeated again. Can occur again. Melanoma, yes, can be related to sun or other issue. In your scenario, about 5 cases of fits. Number 1, easy one, lamotrigine case. This pregnant or patient wanted to get pregnant, but she is want to stop the lamotrigine because she has false belief that lamotrigine is the cause of her infertility.
But her seizures are controlled with this medicine.
Yes, controlled, but she want to stop this because she want to get pregnant. So in this condition, you should correct her false belief that I'd like to assure you that lamotrigine has no relation and doesn't affect your fertility. Number 1. The doctor can affect my pregnancy. I mean, if I get pregnant, can it make a child or affect my baby?
No, no, it has. I highly appreciate your concern. Well, this is a very blessing medicine for you that it has controlled your fates. However, I would like to reassure you that it has no effect on the fertility and on the newborn baby or a baby in the womb. It has no any bad effect on this, and this is a good thing that you can continue this medicine, and you can also be in collaboration with a woman doctor. Your pregnancy can be completed very safely.
Okay. So we have first 2 issues. First, of fertility, no effect of fertility, even on the child or the baby, no effect. If she has difficulty, good looking shit, as you said, we can refer to the woman doctor. He can help her to give her medication to the. And say for as the first, as any epilepsy case, abnormal electric activity of your brain. Do you want to explain the condition first? Because she has epilepsy. Lamotrigine for epilepsy. Are you aware by this condition? It is abnormal electric activity, and you need a lifelong medication to control your disease. Okay? And then assurance about the fertility, and they give her. It is an easy scenario.
Yes.
And about the driving, these things. طيب. The other scenario we talked also appear in your center. We talked about before, but we should revise temporal lobe mass. She has tonic-clonic seizure. And we found the mass in the temporal lobe CT suggestive to be cancer. Now she needs MRI, and the problem here was about driving. I am a lorry bus driving. I am a lorry bus driving. Sorry, I am a heavy vehicle or bus بتاع ده school bus driver. You should. What you are going to say?
Well, I highly appreciate your concern. Keeping in view of your current situation, current medical condition, actually, it would be too risky for you, not only for you, but for other as well.
Yes.
So, we will advise you. We will advise you to stop driving, and we will also write a medical report to your employer and also occupational health officer to relocate you for some safe place.
Okay. Okay, very good. And for also, you should explain abnormal electric activity of brain. Can be occur again, doctor?
Yes, I highly appreciate your concern. Yes, there is an abnormal growth in your brain. Yes, there are high chances that it can appear, it can occur at any time.
Okay, doctor, will you give me medication?
Well, I highly appreciate your concern. As far as your condition is concerned, medicine, yes, we will give you medicine after proper assessment, and it will be decided by the
Yes.
medical team.
Yes, usually. Don't give oxygen. Okay. طيب doctor, is this cancer?
Well, I highly appreciate your concern. Well, cancer it can be cancer, but we cannot say it with surety that it is a cancer. We need further investigation to confirm it.
Yes, include a detailed scan called MRI. Clear?
Yes, sir. Yes, sir.
Okay, this appear also on your center. One of case appeared also, although it is very old case. I don't know why they give tramadol. Patient enter for some, I think, for some procedure in the hospital, and they give him tramadol.
Hmm.
While he have a long history of epilepsy, but he doesn't have any fits since 10 years. And when
Hmm.
you give this tramadol, he developed the fits.
Hmm.
Huh?
Is medical error, sir?
Yes, frankly, error because tramadol shouldn't be, it has a loss threshold in the epilepsy case, shouldn't be given. You have more than 100 other
Yes,
analgesic. Why you give?
yes, sir.
Yes.
Here, I think in this case, the surrogate has main concern because he has fit free for 10 years. Now he
Yes.
was very excited that he will start driving,
Ah,
and then again he
yes.
gave the. So how will we
Yes.
answer this concern?
Yes, first you should first relax him because this is our mistake or our error. Apologize many times and make. If you didn't apologize and didn't admit the error, he will not be relieved.
Hmm.
Must admit that this is our mistake and shouldn't have been happened. And we have written or have raised it to our consultant and discussed in the next meeting and taking steps to avoid this from action. This from bit again. Please accept our apology. As you said, doctor, I have now I haven't this fit since long time. Number one, could it be repeated? Number one, it is or yes or no or unlikely.
Yeah, well, as your condition is very controlled, as 10 years free from fit, and after this medicine, there is no effect. There is no any fit. So we think
Yes.
we believe that it's unlikely that you develop any fit.
Yes, as the cytopheline case and the water intoxication case, the same category. But here we will add this error. طب doctor, now driving. How can I, you here بقى you will again, but don't say any period here. Don't say 1 year or 5 years. Just we need from you to stop driving for a while till we assess you and get sure you are okay. Can I drive again, doctor? Yes, but you need to, for now, you still need to stop driving. And for how long, doctor? I will come back to you. I will ask my consultant. Don't say 1 year or 5 year or 6 months. No,
Hmm.
please. Because, yes, I know sometimes it is written 6 months or 1 year, but some examiner has different opinion or have different guideline. This differ from one center to other, from one region to other. So don't conflict in this region. I will address the concern. I appreciate your concern. Okay, we need first to get sure that you are free from the fits, and then I will check with my consultant the guideline. I come back to you like this. Don't give any time here, please. Okay.
Yes.
This is the tramadol and lamotrigine and temporal loop. One another scenario also all the scenario appeared. She enter also she is taking Kibra, which is لف اسمه ايه ده she is taking Kibra for epilepsy, okay, and she is free from fits also since 10 years. The same idea. Now she enter levetiracetam. Levetiracetam. Okay. She enters the hospital for joint operation, arthritis or arthroscopy, something like that.
Hmm.
Okay, you make her fasting for this operation, and she didn't take the Kibra.
Hmm. So this is a medical error, sir.
Yeah, 100% medical error because
Oh,
even she is fasting, she should have taken this. Okay,
medicine.
يبقى
Yeah.
again it's exactly error. And again, the same category of this tramadol and same category of water intoxication and same category of the theophylline could be repeated, doctor? It is unlikely. Okay? طب can I drive? No, we need to monitor the condition till you are fit free, and they will we can decide when exactly you can drive. When, doctor, I will ask my consultant and I'll come back to you. Clear? So it is a very same idea. Okay, but take care in the water intoxication, no error. It was the patient issue. But here the Kibra is our error because we didn't give her. We should be given the Kibra or levetiracetam. Even she is fasting, she can take the Kibra. Okay, this error. Another one also error, but doesn't similar, but a different trick. Fentanyl patch. Patient with prostate cancer, palliative spread. Okay? Patient with prostate cancer, I will give you the scenario. He's taking fentanyl patches. We missed to give him the fentanyl patches. Here is the scenario. In the hospital, we missed to give him fentanyl patches, written clearly. So he has severe pain. He enters the hospital because of sudden seizure due to missed calcium. Clear? He had many cycles of chemotherapy. Okay? He will give him dexamethasone because he has suggestive of he has meds or not suggestive, he has meds in his brain also. He has meds in his brain. So this is a very complex case. I mean, he is palliative, prostate cancer, brain meds, has seizure, has hypercalcemia, okay, and has meds. We give him dexamethasone to relieve this. But while he is in the hospital, we missed to give him what? His wife, his wife come and she see him in very pain and has bone pain and in miserable condition because of pain. What's your opinion?
It's a medical error. We need to give her some
Yes.
painkiller.
Yes, not only yes, fentanyl will take time to act. You will give him painkiller and ask the palliative care to give him the fentanyl patch and the other painkiller to control and apologize. This you have missed as a anti-Parkinson also in your center. Anti-Parkinson not given. Same here. We don't give him the fentanyl. This is the first concern. يبقى number one, it is clear error, clear cut, no debate about it. Number two, she will shift to the seizure. Is this seizure, what is the cause of this seizure and could it occur again or not? This is another dilemma.
So seizure can occur again, sir. Why not?
Yes, because he has spread to the brain.
Metastasis in the lungs, yes, sir. There's a lesion is there.
And the brain. And the brain also, he has brain, number one. Number two, he has raised one of his blood salt called calcium. Give him medication to control this called dexamethasone. However, I am sorry to tell you that this can be repeated again. Give the safety netting. What is the safety? Number one, the palliative care Macmillan nurse. Number two, while he is in the discharge plan in the home, don't let him lock the door from inside or be alone because he can develop the fits. Yes? يبقى this fits like the temporal lobe mass and for sure. And he also has hypercalcemia, meets many disaster condition. And this also the consultation case, it fits in cancerous patient, same. But we'll adjust here the error of fentanyl patches. Missing. Clear?
Yes, sir.
So this is the epilepsy scenario on side basis. Yes, we have here also quadranterobia, يبقى lamotrigine, okay, and myotonia. Okay. Another scenario, this stroke patient with on AF, okay, and you has improved, his stroke has been improved except one thing. This in your center also. They add this silly diagnosis, homonymous quadrantanopia. How to say this because this is homonymous quadrantanopia.
Sorry, you will say, I will listen.
Easy. He said after that he described through it is a visual field problem. Okay, because of do you drive? We need from you to stop driving. Why? because your vision is affected, and this can lead to an accident if occur and can harm you and the other also. So we need from you to stop driving. Doctor, how for how long can I cannot stop driving? I'm sorry to tell you that it will be too dangerous for you and for others. Doctor, okay, for how long? You should inform the DVLA and they will decide exactly for how long. Is it forever? Can I resume again driving? I appreciate your concern. However, the DVLA will assist you and will inform you about when exactly you can resume in driving. In this condition, no time frame, we don't know. Might improve, might not, according. The other task in this condition, you have two tasks. The first task is this homonymous other preventive strategies for his, because he has AF and has has a stroke. Could be repeated again. You must explain what is meant by stroke. Okay, blockage of one blood channel supplying your brain, leading to the weakness you have. Fortunately, you have improved your weakness, but still you have this vision issue. The cause of this stroke or blockage of blood channel is a condition called AF triple bridge. Have you heard about this condition before? Abnormal heart beating, draws the heart, and can be repeated. I'm sorry to tell you that we need from you to keep on regular your medication. They didn't say which medication they are take. Is it warfarin? Is it DUAC? Not our job. On the blood thinning medication, you should take the blood thinning medication every day. Okay, and we have a regular measuring the blood thinning medication or Eurobic level. Okay.
Yes.
Like this and finish, but the most important here to explain the condition, to explain the quadrantinopia and to address that she shouldn't drive till DVLA assess and reevaluate her. Clear? Take care, because hematuria, I said before, the hematuria after stoppage the warfarin, hematuria and stoppage of warfarin then developed stroke, not error, in the best interest of the condition. This can you this slide. Clear?
Yes, sir.
Myotonia dystrophica scenario and myotonia dystrophica scenario. No, not here. The patient has delivered a baby with myotonia. Talk to her. How you? This one came in your center also. This scenario when appeared for the first time, it was a disaster because suppose that you are the first time to see this scenario. I think most of the candidates in this scenario يعني, has a panic attack when this is for the first time. But this was about 6 or 7 years back. This patient developed or delivered a baby which has become floppy, and he was diagnosed as having myotonia congenital or myotonia dystrophic myotonia, congenital dystrophic myotonia. Okay. Now you will talk to the mother. I mean, this is disease explanation. How you can explain myotonic dystrophy in non-jargon manner and complication and safety net. Yes.
It's a medical term for medical condition in which a familial condition in which runs in a family in which there is an affection of the brain cells leading to the affection in which the affection of the muscles of the body and leading to permanent weakness of the muscles of the body.
Yes. Irreversible, progressive, and no treatment, and may affect the muscle of
sir, any muscle can involve.
Yes, you should give her the most
yes,
important
muscle of the breathing. Yes, sir. Muscle of the muscle of the swallowing, muscle of breathing, muscle of talking, muscle of walking.
Yes. Like. This is the most because this he will die of what? He will either aspiration pneumonia or swallowing issue or respiratory failure. Because yes, but the other disability, his hands and legs weakness, yes, progressive, irreversible. And I am sorry, and I am also the extra, the most important also, what in the heart can make him die.
Yes, also arrhythmia, heart block.
Heart block, yes, you will say may abnormal heart beating. I'm sorry to tell you, we need to monitor this condition. Yes, he will die either of heart block or respiratory failure or aspiration pneumonia. This is the most important. But diabetes, most of the people has diabetes. Thyroid, most of the people, or many people has thyroid, not an issue. He will live as usual. Hypogonadism also can, but this is a chronic or cold condition. Many people have this condition. Yes, endocrine issue in many people, but heart block can make him die. We need to monitor by the tracing of the heart, blowing test, and many tests. طيب, she will give you 3 or 5 concerns. First round in families, you should say this because he will bombard you by 3 concerns about the family. Her mother, her sister, her other brother of this child, and her herself. Should I do genetic test, doctor? Should my mother do the genetic test? Should my sister do the genetic test? Should his brother do the genetic test? Why you want to do genetic test? Because I feel weakness in my arm. Because my mother has cataract. What you are thinking of? She ask about each one. Mother, sister, the brother of the child, and him herself.
Well,
يلا.
I highly appreciate your concern. Yes, it's a familial condition that runs in a family. I mean to say, there is 50% chances that your children or your family, other family member can involve in this
Okay.
condition. So we routinely do not perform genetics as there is no benefit because if there is any symptom, if there is any weakness, then we perform it just to catch the diagnosis. But
Yes,
we
because
do not do it for screening because we do not have a curative treatment. What we will do
yes,
by doing the
yes,
diagnosis?
will not change the outlook of disease. Yes,
Uh,
unlike and Hokam clearly say to it. But if you want to sit with the genetic counselor, we can have or make we can arrange a meeting with the genetic counselor. Okay, no problem. She can sit, no problem. But to clarify to her that this will not change the disease course because it is irreversible damage of the muscle, not the nerve. Take care. Unlike the motor neuron disease, mainly the nerve. The motor neuron disease is in the nerve. إنما here the muscle itself. طب the mother the same. The cataract may be related to the other thing, may be related to the age. Who said that? And also we can have a sitting with your sister or mother. They can decide for themselves. Why she decide for her? She has the autonomy. We can have a sitting or chat with your sister or your mother. Okay, to if she want to be have a sitting with the genetic counselor. Other baby, if he has any weakness, you can but give her just the safety netting about the mainly the bulbar symptom and heart block, most important. Her herself also the same. Okay, if she has we can monitor the condition. If you want a sitting with the genetic counselor, okay, but it will not change. Okay. طيب يبقى don't forget it is a familial runs in families. Don't forget irreversible and progressive damage of the muscle, including muscle of the arms, legs, and most important, muscle of the breathing and the swallowing, which can lead to breathing
even
failure.
even can lead to heart problems.
Yes,
This is
even
very
can affect
important.
the heart beating, which is could be fatal. We need to monitor your child by doing some tracing and some blowing test to assess this serious complication. Clear? طيب unlike بقى if ADPKD we discussed if was end stage. طب ADPKD without any I mean normal kidney function, normal blood pressure, but her father has ADPKD. Now she performed ultrasound and confirmed that she has ADPKD, but everything is normal. What you are going to safety net here or precaution?
We will advise. I will highly appreciate your concern. Well, I would advise you because I will advise you to stop smoking and to avoid contact sports like rugby and heavy
Yes,
machinery and
yes, very important.
going and any avoid any trauma as much as you can. And
Yes, and avoid start
we
any
advise you
medication
to have
without
a
telling us.
yes. We advise you
Avoid
to have a regular follow up at the
yes.
kidney doctor, multidisciplinary
Okay.
outpatient.
And avoid start any medication, especially painkiller and antibiotic, without telling us can harm her kidney. Take adequate fluid or adequate water. We will assess regularly, assess in the kidney clinic your blood pressure and water work for any change. Okay, any contact sport, avoid it. Okay. Will my children
Then
have this?
Yes, highly appreciate your concern. Well, there are 50% chances that your children can have this disease.
How I
Uh,
can prevent? Can I
well,
prevent them from having?
I highly appreciate your concern. I'm sorry to tell you, it's not preventable. We need to screen your children if they are with a scan of the tummy.
Okay,
And
okay. If the children more than 20, but she is fiancée and still not have children, she want to prevent this. You can say we can refer you to the fertility and woman doctor. They have new procedure called over-selection. Okay, not guarantee, but can change the chance. Don't say not preventable because over-selection, they can detect this polycystin gene and avoid the over having polycystin gene. So refer to the fertility doctor and woman doctor. They have new techniques, include what we call over-selection. They might help you as this regard. Full stop. Number two, will I end up doctor in dialysis as my father?
well, I highly appreciate your concern. Well, this is a disease. However, we need to monitor you in every follow-up.
Okay.
However, yes, patient develop kidney failure, but most of the cases develop around the age of 60, 50 to 60. And
Yeah. Okay, don't say any figure. I think, yes, I am sorry to you get that. It can slowly progress into affect your kidney function. However, with taking some precaution, this can delay the the appearance or the occurrence of our affection of your kidney function. By the precaution we are telling you now. Number three, or the other number, you must also ask about if other safety headache. If you develop any severe headache or any weakness,
uh,
you should tell us because sometimes this ballooning or sac-like dilation of one blood channel supplying your brain. Do you have any family history of stroke or sudden death? Okay. Because of this positive, we might need to do a scan with dye for you. For perianeurysm. Okay. First, when describe, it is fluid-filled sacs that compress your kidney, affect its function, can lead to infection, can lead to stone formation, can lead to like this. Raise the blood pressure. Okay. Okay, doctor, can this affect my pregnancy?
Yes, highly appreciate your concern. It is not directly effective pregnancy, but we will advise you to have a pregnancy in collaboration with woman doctor.
Yes, bland because sometimes we increase or raise the blood pressure can occur with pregnancy. Like this, it is an easy scenario.
Yes, sir.
Okay. We have another scenario. I was thinking it is not in your center, but I discovered also it is in your center. It is an easy one, but I will see how you can say. But I will just go for praying 1 minute and come back till you prepare it. Okay, this is take a screenshot. Read it well, and I will ask you the concern in this scenario. It appear in your center also, not in 24, and many other center. Okay, take a screenshot. I will come in 1 minute. Yes, Dr. Norman. Have you read it?
Yes, sir.
Okay. How you can say non-Jargon runner Steven Johnson syndrome?
Sir, first of all, I want to drive this scenario.
What? What?
Say, sir, I can. I want to. No, drive this scenario in my own words.
I mean you want to make it? Yes.
Yes, yes, sir. Well,
Okay.
okay. Can you tell me what, how much you know about your health, about the health condition of your wife?
Yes, doctor. I find they called me in the and told me that my she gave a delivery and she told me my wife is very critical condition. I don't know actually what she, how she is doing now. Why she become worse, doctor?
Well, I highly appreciate. Well, I am sorry. Well, actually, your wife admitted her and gave a delivery. After that, she developed a high temperature and some other problem. We did some tests and we found that she has some bug infection. And we gave bug killing medicine in the best interest of his condition to treat this bug infection. But I want to tell you something concerning for you, very concerning
What's
for us, concerning for us. Mm, uh,
yes?
she developed one of the condition we call it Steven Johnson syndrome. Do you know about it?
No, doctor. What is this?
It's a medical term for medical in which their body develop multiple fluid-filled rashes on the body, and it's a serious condition, and it can involve even internal organs of the body like kidney, liver, and I'm sorry to tell you that it has involved the kidney and liver of your wife, and it can also affect the breathing, and it has affected the breathing. I'm sorry to tell you.
Why, doctor, she developed this condition? I don't understand.
Well, I'm sorry to tell you. Well, I highly appreciate your concern. Well, we gave we gave an antibiotic. Gave a bug killing medicine
Okay.
for her bug infection, but she
Okay.
developed and one of the unpredictable bad effect of the medicine, this Steven Johnson syndrome.
You mean, doctor, this is your error, that allergy to this medication? Why don't you for him skin test to know this allergy?
While I highly appreciate your concern, this is one of the I can understand yourself. You are very concerning about your condition of your wife, and I appreciate your feelings. Well, and I'm sorry for the suffering of your wife. Well, actually, this is a kind of reaction to the body, which is highly unpredictable, and even there is no any test to judge whether a person will develop such reaction with this medicine or not. Although we gave this medicine in the best interest of her condition because it was the need of the time for her condition. And but unfortunately she developed one of the unpleasant bad effect of this medicine.
But doctor, I see in the hospital if they do this skin test, they can avoid this. Why you didn't for my head this skin test?
Well, I highly appreciate your concern. There is no specific any test that can tell us that it will develop this Stevens-Jones syndrome or not. There is no any special. Although this is a very rare reaction, a very rare reaction to this medicine.
Okay,
But
doctor, will she recover and become okay?
well, I highly appreciate your concern. Well, I'm sorry to tell you that your wife, the kidneys and liver, internal organs are involved, and because her condition is serious, she is breathless, and we want to shift him into intensive care, and we want to connect him to the machine we call a ventilator for oxygen support. And her condition is very serious, and I'm sorry to tell you, and I'm afraid to tell you, her condition is very serious, and chances of recovery is very low or futile.
What you are saying, doctor, you mean is that there is no treatment for her condition? What you are going to do for her? Is there any treatment?
Well, I highly appreciate your concern. Well, I can say I can see we are concerning of health of your wife, and I'm very sorry for your suffering. Well, there is no her condition is very serious and advanced because of this reaction. The
Okay.
TTT, although TTT is trying their best to monitor him to give him the best available medical care, but her condition is very advanced, and the chances of recovery are very low.
Okay, doctor. طب doctor, where is my baby?
Well, I highly appreciate because your baby is fine, and he is with a baby doctor.
Who is taking care of him and who will take care of him?
Well, I highly appreciate your concern. There is a team in the baby with involving and baby doctor. There's a whole team. They are caring their your baby, and they are feeding, and everything. Every kind of care is being given to your baby in the.
Okay. Okay, doctor. Okay. Thank you. Okay, well done, Dr. Nu'man. You did it very well, actually. Don't say it is allergy. You said, as you said, severe unpredictable reaction. He will try to check you many times. Allergy, skin test. No, no, no. Unpredictable. Say it many times loudly. Severe unpredictable, as I said. And I said it is unfortunately affects the liver, kidney, and also the lung. Lead to, but say that we need to will involve the skin doctor, the kidney doctor, the heart doctor, breathing for support here. The multiplicity. The baby, yes, also common mistake you didn't make. Fortunately, most of the can say social worker. No relation here. Nurse. We have a specialized staff nurse that taking care of the baby. Because even if her mother die, he will educate him how to take care of his feeding and like this. Okay? Social doctor, not here the culprit. The culprit is the nurse, specialized staff nurse. Okay, don't say also in the management because no specific treatment. Some people say IVIG steroids. This is not specific. The team will decide exactly the supporting medicine. However,
Yes, sir.
her condition is
Sir, his condition is multi-organ failure is there, and condition and
yes,
breathing everything. Where prognosis is poor now.
yes, poor, but we will not her also. We will have support. Okay, who
Hmm.
might there is high rate of that high risk or critical, but however we have supporting team. We are helping here might improve. Okay, but as you said, it is the outlook of this disease is not good because he
Hmm.
has at least two
And
or three
I
systems.
said the chances of recovery is low.
Yes, yes, yes. Her condition is critical now. Because she has, as you said, impairment of her kidney function, impairment of her liver function, and also impending breathing failure. need to put on artificial machine or a supporting machine, and I am sorry to tell you that her condition is very critical. However, there is supporting team, okay, that can help her. Like this, but be on the yes, on the as written in the scenario, on the poor prognosis side, because her condition is bad. Unlike the baby, is a so severe unpredictable reaction. This appeared in your center. Clear? You did it very well actually. The amiodarone scenario appeared with fibrosis, as you know. No one told me about. No, he will took your son. No one told my father that amiodarone causes scarring in the lung. He now come with fibrosis in the lung because of amiodarone. Talk to his son. Okay? Everything showed restrictive lung disease. No one told my father about this scarring, doctor. Huh? As an avascular, yes.
I highly appreciate your concern. This is our usual practice that we used to prescribe such medication. We used to tell the most common and the most serious side effect, bad effect of medication. But I'm sorry for your suffering. Well, let me check this point from my colleague, and then I feedback you. And otherwise, this is our usual practice that we used to tell the most common. And I would like to assure you that we gave this medicine in the best interest of your condition.
But what, doctor, is it reversible?
Well, I highly appreciate your concern. Appreciate your concern. Well, we hope that we have stopped the medicine that has caused it, and we have changed it to some other suitable medication. We hope that it will improve, and the chances are high that it will reverse. But there are cases.
In pneumonitis, methotrexate pneumonitis, usually reversible, but in scarring, might improve, but unlikely to be reversible because it's fibrosis. Okay.
Okay.
So now, yes, fibrosis with restrictive lung disease might improve, but I am sorry to tell you, it is unlikely or less likely to be totally reversible. Might improve. Okay. When we stop and start him on steroid. طيب, doctor, why you, the doctor give him this amiodarone in view of this side effect, while he already, if this scenario come, have another device. He has ICD also. Yeah, I mean, you give him ICD and amiodarone. Is ICD might be sufficient? Why they give him also this bad medicine? Okay, this is take care from this concern. We have 4 chambers. You will say the patient like this. Abnormal heartbeat coming out from the upper chambers, that's usually controlled by the amiodarone. Unlike the serious abnormal heartbeat coming from the 2 lower chambers, controlled by the device. Okay, this is for VT. ICD to prevent the VT, not the AF, but amiodarone mainly for the AF or SVT. Okay? SVT or supraventricular tachycardia to control the abnormal heart beating coming from the mainly, but the device mainly to control or to prevent the bad rhythm or bad abnormal rhythm which might happen from the lower 2 chambers. Okay? Because ICD has no relation to the SVT. Clear? Like this. So sometimes it come only amiodarone induced fibrosis. Sometimes come with both these to the device also to put the concern why you are giving him amiodarone and ICD, because we have 2 types. He has SCVT and he has also bad arrhythmia or sinister bad rhythm from which means VT, ventricular tachycardia. Okay, you also just bad arrhythmia from the lower. So in this patient, he has SCVT, and we give for him amiodarone, and has VT, and we give him ICD to prevent. Clear? This is the trick in this scenario. Okay? This sometimes come only with a amiodarone fibrosis, and they will say, but unlikely to be reversible, unlike the other scenario, methotrexate induced by pneumonitis. Pneumonitis usually reversible. Clear? And
But
we'll
the
monitor his
fibrosis,
condition.
wherever fibrosis or scarring there, it will not be reversible.
Unlikely. Don't say don't or won't. Say unlikely. Also, pneumonitis say likely or to be reversible. But here, unlikely to be reversible. Might improve after stop the medication and start him on other steroid. And we'll monitor his condition by blowing test and scans. Like this. Who is taking care of your father and the social at the end? In your center also comes the old scenario, an easy scenario. Methotrexate start in rheumatoid arthritis. Easy one, or psoriasis, but in your center rheumatoid. What is the precaution and the benefit and harm of this method?
Well, it is one of the best medicine in the treatment of your condition. However, every medicine has its benefit and side effect, and its bad effect and benefits. As far as the bad
Okay.
effect of these medications are concerned, it has some bad effect, like it can decrease your ability to fight with an infection. It can reduce important blood count. It can even cause scarring of the your lungs. But however, if we compare the benefit versus the bad effect, the benefits are very high, as it is a very good medicine in the treatment of your condition. So don't worry about the bad effects. We will give this medicine, and we will continuously monitor you by some assessment and by some important tests. And we will also give you some protective medication along with this to prevent any bad effect. And as well, and I have advice for you that your pregnancy should be planned. And as far as once your pregnancy is planned with, and may change this medication to some suitable medication, because it can affect the your new baby in the.
Okay. Okay. So scarring not only the lung, also in the liver may affect liver function. Okay, and the
Yes.
bone, as you said, factory of the bone, and we give another medication to avoid this and do under monitor, doing regular blood count and scans on the lung, blowing test, and the liver and liver function. Might affect the pregnancy blend and stop 3 or to 6 months before. Like this. Most important, it is decrease or prevent the progression and the damage of the joint because it is the MAR, disease modifying, unlike the painkiller. Okay? So it is very important. Doctor, no, I will not take this medication. I heard about other medications for the biologics.
Mm.
Give me the biologics, doctor.
Well, I highly appreciate your concern. Well, this biological agents are again a good medicine in the management of your condition. However, for the time being, after your reassessment, after assessment of your condition, the best available medication in your condition is again
Oh,
methotrexate, and we will assess this after giving you this medicine. If it will not work well, then we will think for some other medicine, like as you told, biological agent.
yes, because it also has other side effect, even more than the methotrexate. Might have other side effect and also take time to act also. طيب, biologics also, another scenario, an easy scenario also, ulcerative colitis, new diagnosis, or counsel about ulcerative colitis and start on steroid. Sometimes come no, doesn't want to take steroid, sometimes other, but you should, easy scenario also, ulcerative colitis, you will say soreness in the large bowel. And don't forget to ask to say about the complication might develop into cancer or scarring of the small tubes, giving or providing the digestive juice, as we told us, the primary sclerosis conjunctivitis. Okay, this and some extra intestinal manifestation might lead to redness of the eye, joint pain of this ulcerative colitis. And the medication option, if told you he want to start on steroid or refuse steroid in ulcerative colitis. Huh? What you are going to say?
He refuses. He refuses steroid. Well, I highly appreciate your concern. May I
Yes.
know why you want, why you are refusing?
Because I heard, yes, very good. I heard about it has many side effects such as weight gain, doctor.
Well, I highly appreciate
And
your
I heard,
concern. Yes,
yes,
sir.
I heard also it can cause cancer. Steroid can cause cancer.
Well, I highly appreciate your concern. As far as the cancer is unlikely that it causes cancer. Well, actually, we will give this medication. This is the best available medication for your condition. And furthermore, we will give this medication not for a long time. We will give this medicine just for a short period of time till we control your disease. Once the disease controlled, we will convert you to the some other good medications. This is just for a short
Okay.
period of time.
And will make you symptom free. I am a
And wait,
PhD student.
yes, yes, sir.
Yes,
And it is a
control your
medicine that
symptom.
keep you symptom free.
Yes, she enters or he enters the bathroom 6 times a day and interfere with his doctor arbeit or doctor thesis formation. So it will keep your symptom free and will monitor your condition if you develop any
Mm,
weight gain, high blood pressure, high blood sugar. Doctor,
mm,
and it doesn't cause, okay, say clear, doesn't even decrease the risk because the disease itself can proceed into cancer, ulcerative colitis. Give me,
mm,
doctor. I read about a very good Chinese herbs. I
mm.
wanted to take this herbs, okay?
Mm. Well, I highly appreciate your concern. Well, this China maybe I don't know about this medicine as it is. We used to prescribe the medication that are recommended by an well-known authorized authorities, and we don't know about
Yes.
anything about this medicine. However, the medication that
No,
we are giving
yes. Side
is the
and if
best.
you develop any side effect, we cannot deal because we don't know how they work. Unlike the
Mm,
steroid, we can know everything about steroid. But doctor,
uh,
I heard about other medication for the. Can you give me other medication? Is there any other medication than steroid for ulcerative colitis?
I highly appreciate your concern. Yes, there are other medications available, but for this medicine, as prescribed by the medical team, is the best medicine in the best interest of your condition. And there are other medicines so need to tell the other name of the medicine. What?
No, no, no. Other medicine globally, for example, methotrexate, cyclosporin, biologic, has more side effect and take longer time to act. No, but steroid
Uh,
act very rapid. What is, we give it
it's a,
steroid, especially in
this is
flare.
the best medicine.
Yes,
Act very fastly as compared to other medicine. Other
yes.
medicine take time. Yes, and have more side
Take
effects.
time. Number one, two. Also, methotrexate and other and cyclosporin has even more side effect. No
Mm,
medicine without side effect. Okay,
mm.
at the end, check her understanding and must ask, what do you think about that? How are you going to start or to compliant with? Yeah, must check the understanding. Clear?
Mm,
This
okay.
is us, and this is easy and old scenario, but came on your center also. Clear, Dr. Nu'man?
Yes,
This
sir.
is some of the scenarios appearing in your center, and they are not new. All of them are repeated. We can
Yes.
continue, inshallah, tomorrow, but I will tomorrow, inshallah, at 6 in your, which means 4. Okay?
Uh, okay, sir. Okay. Okay.
Suitable for you? I mean, we will postpone I will be 6, 1 hour later. 6 in
Yes.
your in Pakistan time, which equal here 4. Clear? Okay,
Okay,
Dr.
okay, sir.
Nu'man?
Yes, sir.
And inshallah, yes, keep reading and keep revising the thing, inshallah, in order to pass. Your level is okay, accepted, yani, but just keep and be very calm.